Hey, I'm Jeremy. I'm going to be your nurse today. We're going to be doing a quick cardiovascular assessment on you, okay?
Okay.
Wash my hands. Can you tell me your name and date of birth?
It's Anna Pratt, 3/12/98.
Okay. All right. Very good. Very good. Okay. First thing I'm going to do is I'm going to ask you a few questions, okay?
Okay.
Do you have any personal history of heart disease, heart attack, heart failure, rheumatic fever, or any varicosities?
No.
Okay. And do you have any family history of heart disease, hypertension, high cholesterol, obesity, stroke, rheumatic fever, anything like that?
No.
Okay. Currently, do you have any of the following symptoms? Feel free to ask me if you don't know what one of them means.
Okay.
Fatigue, dyspnea, orthopnea, edema, any coughing, chest pain, syncope, hypertension, hemoptysis, palpitations of your heart, or anything like that?
Nope.
Okay, very good. And next, do you, we're going to ask about any activity. So do you smoke or drink or anything like that?
No.
Okay. What about your eating or exercise habits? Anything out of the ordinary there? Do you exercise regularly?
I do.
Okay.
30 minutes a day,
Okay.
and I try to eat healthy.
Okay, very good, very good. And do you have any stress in your life?
I'm in nursing school.
You are, okay.
So
All
that's
right.
my stress.
Understood.
right
So
now.
am I. So
Yeah.
that I can empathize with you there.
Yes.
And to what degree? I mean, would you consider that just maybe a mild to moderate?
Probably mild to
Okay.
moderate.
All right. Very good. And let's see. I was going to ask you a couple other things.
Mhm.
Do you have any family history or history yourself of any heart affective diseases, like maybe diabetes, obesity, any endocrine hormone type disorders, or anything like that?
No.
Okay. All right. Very good. So now what I'm going to do is I'm going to listen to your heart.
Okay.
And I'm going to listen in a few different places, okay? So the first place I'm going to listen, actually before I do that, I'm going to look at your kind of just your general appearance. Your skin is not flush, but it's also not pale, so that's good. And you do not have your jugular veins are not distended, they don't appear to be. So that's a good thing as well. I'm going to palpate your carotid pulses
Okay.
right here on your neck, and I'm just going to be kind of doing that for rhythm and amplitude, okay? Okay, so you have a nice steady rhythm there, and amplitude, I put it pretty regular, so probably about 2 on the left side. On your right side, same thing. Okay, very good. Now I'm going to listen to your heart.
Okay.
And like I said, I'm going to listen in a few different places.
Okay.
The first place I'm going to listen to is going to be your aortic point.
Okay.
So that is going to be at the right sternal border here at the first intercostal space. Okay, and here we're kind of again listening for the presence of S1 and S2
Okay.
or any abnormalities. I didn't hear any abnormalities. I
Okay.
did hear S1 and S2. So now we're going to move. We're going to move to your pulmonic point, which is on the other side of the sternal border. So the left side of the sternal border at the first intercostal space. And again, we have presence of S1 and S2 with no abnormalities. Now we're going to move to your tricuspid,
Okay.
which is going to be at the fourth intercostal space,
Okay.
there on the same side, the left side.
Okay.
All right, and we also have presence of S1 and S2 with no abnormalities. Can you lift your tank top up? I'm going to now listen to your at your mitral valve.
Okay.
And again, we're listening for presence of S1 and S2, which we hear, and we do not hear any abnormalities. All right, now I'm going to, you can just hold that up. I'm
Yeah.
going to listen for 1 minute be doing that for the amplitude and the rate on your apical pulse. And the rhythm very steady, and I got a heartbeat of 74. Okay. So again, very, very much in the normal expected range.
Okay.
So now I'm going to do palpate some of your peripheral pulses.
Okay.
So I'm going to actually start. I'm going to do them on both sides, but I'm going to start with your radial pulses. So if you can just kind of turn your arms over for me right there, and here we are looking for the rhythm and the amplitude of these pulses. They both feel a steady rhythm, and the amplitude I would say is about +2. All right, now I'm gonna move to your brachial, so if you can kind of, there you go, perfect. And again, about a +2 amplitude there. All right, very good. Now I'm gonna go to your femoral, so if you can just kind of slide up on the bed there. I'm gonna feel these, and these are gonna be kind of right here. There we go. And the amplitude on these is a little bit less, which that's not necessarily uncommon.
Mm-hmm.
I'm gonna have that at a 1. All right, now I'm gonna move down here below your knees to the popliteal. Okay, and those feel very good. So again, amplitude there is about a +2, which is what we expect. Now I'm going to do your dorsalis pedis here on the top of your foot. Okay, another +2 on amplitude. And now I'm going to feel the posterior tibial here.
Okay.
All right, and again, +2. Now, if you want, you can stay where you are. I'm going to do your, I'm going to check your extremities, upper and lower.
Okay.
And I'm going to be looking for the color, the temperature, and the capillary refill time on there, okay?
Okay.
So I'll just do this one first. Color is pink, which is as expected. Temperature is warm but not hot. And capillary refill is almost instant, so certainly less than 2 seconds there. Same thing here. Color is a good pink color. Temperature again warm but not hot. Cap refill is once again instant. And we're going to do the same thing down here, looking for color, temperature, and capillary refill. Color on your feet is pink, as we would expect. Capillary refill is almost instantaneous again. And the temperature a little cooler, but certainly not cold or anything like that. So I think we're good there. Now I'm going to do the DVT assessment tool.
Okay.
And I've actually got that right here. And I'm just gonna ask you a few things. Some of these I already know from your chart.
Okay.
So we're gonna talk about these. Some of these are just risk factors for deep vein thrombosis.
Okay.
And that's basically a blood clot in your body, and we need to make sure that we find those immediately and get them taken care of if that's the case.
Okay.
So the first few things I can answer for myself. Let's see. Your chart says you've never had any any myocardial infarctions, congestive heart failure. You have no history of inflammatory bowel disease or prior major surgery.
No.
Recently. Okay. So you have a 0 on these, and then a few more risk factors that represent 2 points. Let's see. You've never had any malignancies or anything like that, right?
No.
you're not confined to bed,
Mhm.
those types of things, so you don't have any risk factors there. And then these last few are significantly higher risk factors as they represent 5 points. You've never had, or you haven't recently had a stroke or any multiple trauma,
No.
elective major lower extremity arthroplasty,
No.
hip, pelvis, or leg fracture,
Mm-mm.
or acute spinal cord injury, okay? And then these other few represent 3 points, so a little less than the highest risk factor, but you're not positive factor 5 leading, at least according to your chart, correct? Okay. Heparin-induced thrombocytopenia, family history of thrombosis.
Nope.
Okay, very good. So your total risk factor is a 0, which means that doesn't necessarily mean there's no risk, but it means you're at a very low risk, what we would call for DVT, which is exactly where we want to be.
Okay.
So very good on that. And I'm going to wash my hands and done.